like to wish all the ladies in our audience a happy International Women's Day 2022. I'm Dr. Namita Surya, head of the Women's Wellness Center at Lanka Hospitals. On behalf of Lanka Hospitals, I would like to warmly welcome you for the webinar areas of importance for women in commemorating the Women's Day, which is on the 8th March. It is a special day which is celebrated to show the importance and significance that women have on their lives and of their families and society at large. Maintaining good health and taking care of their body are two major aspects which goes hand in hand in making women live a happy and a long life. Through this webinar, we hope to bring you a bit of cancer awareness and cosmetic surgeries. I will briefly take you through the agenda for today. Our first resource person is Dr. Thushan Beneragama, visiting consultant plastic and reconstructive surgery at Lanka Hospitals, who will enlighten us on an interesting topic which will be beneficial for all the ladies who wants to stay beautiful irrespective of their age, which is effect on cosmetic surgery on self-esteem, followed by an awareness session about breast cancer by Dr. Kanchana Wijesinghe, visiting consultant general surgeon with special interest in breast surgery at Lanka Hospitals. Our third resource person would be Professor Nishendra Karunaratne, resident consultant obstetrician and gynecology at Lanka Hospital, who will be enlightening us on laparoscopic procedures for women and the latest updates. This webinar will be live streaming on our Facebook page and YouTube channel. We would encourage you to ask us queries by posting your questions on the chat box, and we would be answering them at the end of the session. Our next topic for today is on laparoscopic surgery for women. I would like to cordially invite Professor Nishendra Karunaratne, resident consultant obstetrician and gynecology at Lanka Hospitals, to enlighten us and our audience about laparoscopic surgeries for women. Over to you, sir.
Yeah, good afternoon to all the viewers. What we're going to discuss here today is the role of laparoscopic surgery in women in gynecology, which is not a new topic. It's been used in laparoscopy for last maybe couple of decades now. Yeah, you know what is laparoscopy. When somebody goes like to ask for a surgery, what could you think in the first place is going through anesthesia and the big knife comes and cut your tummy and open it up and do the surgery and come back to the big scar, then stay in the hospital for 4 or 5 days and then staying at home for 6 weeks sometimes and still having pain, that sort of thing. But this change when the laparoscopy was introduced to all the surgical field, and even the patients, I think everyone know aware about laparoscopies, endoscopies, and all copy things, which basically doesn't give you much trauma. And also, these are more advanced. And earlier, there were some limitations about laparoscopic surgery. I think for you to know about new advances and how much we can do with laparoscopy compared to the open surgery. And it's commonly known as keyhole surgery, and it's done with instruments go into your tummy. That's working. Yes. Yeah, they go through your tummy in certain places, and then a light goes in. The light and the camera is here, and your instruments are there, and you can see nicely and clearly all the organs inside the tummy. And this actually need modern instrument, and it's a more advanced method of surgery, and a lot of training is needed, and should be done in a specialized centers which the facilities are available. And we have many number of surgeries which we could do from the laparoscopy. Initially, it could be used as a diagnostic for a purpose. and then drilling of polycystic ovaries, endometriosis, and ectopic pregnancy. I think you can do almost all the ectopic pregnancy laparoscopy, fibroids, adhesions, cyst, womb removal, hysterectomy, and new things are the surgery for the incontinence and the surgery for prolapse. And also, I just want to mention about hysteroscopy, which is a smaller form of laparoscopy, the small instrument which goes into the womb, and then earlier it was only for diagnostic purposes, but now we can remove the polyps, the fibroids, and septa, and almost everything that we have to we had to do in a patient with relevant complications. And it's we can't forget endoscopy if you run a subfertility clinic, because most of the patients, the problem for subfertility is having some kind of defects, or like in the sense, some kind of pathology in their genital tract. So once we diagnose that, we can use laparoscope and we can correct it. For example, if there are polyp, we can remove it. And also, it is of course a less traumatic form of surgery. The biggest advantage here is, if you are in a treating process, and then if you were to treat a certain condition which related to the female genital tract, and we can treat, and from the next month itself, we can go back to our treatment process, because the trauma and the damage done to the surrounding tissues, or maybe for the system, is very less in laparoscopic surgery. And there's a condition called endometriosis, and it is a disease which you get a lot of velvet-like, the bleeding tissues around the womb, the ovaries, and sometimes other places as well. And this is a really agonizing condition for the patients, where you get a lot of pain during the menstrual cycle. Once it's come to the advanced stages, even other times also you have the pain, and the sexual intercourse is painful, and the bowel functions, bladder functions, all are being affected. Endometriosis could be treated well and completely with the laparoscope, because the laparoscope has a better visualization. This picture shows womb and the ovaries, which have been all adhered and stuck together to the bowels and the side walls of the pelvis. If you do open surgery, you can do to a certain extent, but you can't get to certain places because all the things have been covered with other tissues. But in laparoscopy, once you get the good visualization, and once you get the other tissues back with certain methods, you get a very good picture. And the laparoscopy is the main way of treating endometriosis these days. You not only you can remove the endometriosis in the ovaries and the uterus, but you can go up to the level of pararectal. That means the endometrious tissues around the back passage and the bowels and everything could be removed with laparoscopy effectively. Yeah, fibroids is another condition. The fibroids are the muscular tumors coming in the uterus. Usually we see in ages of 35 and after, but still we see fibroids in young girls as well. These fibroids can grow, and can they enlarge even up to 22, 23, 24 centimeters. One like even sometimes it covers whole tummy. If you identify the fibroid, and then again, now you don't have to make a cut and remove it with laparoscopy, and there's a special technique called morcellation, and the piecemeal taken out. And using these methods, we can remove the fibroid inside the womb, inside the tummy cavity, and take them out through a small port of around 1 centimeter in diameter, piece by piece. And for example, if you are not married and you're diagnosed your fibroid, and then again you have symptoms with the fibroid, and I don't think you would ever think of a surgery to remove it because it's give you a scar and then again it can cause other side effects as well. But if you request for a fibroids removal by the laparoscopy, of course, it's only a three small holes, and then we can completely remove the fibroid. And we have experienced fibroid surgeries when you go for the second time. Now, once you do the surgery on the womb, and especially in a fibroid surgeries, next time you go in, you see the surgical site or the other sites are being stuck to another organ, like the bowel channel, we call it adhesions. But in laparoscopic surgery, the adhesion formation is very minimal, which in turn has less complication post operatively. The additions are something like this. You get all the things get attached to each other, stuck to each other, and you can identify the different structures separately. And this is a condition where we come across commonly in subfertile, like people who are coming to the fertility clinic when the stuck tubes and ovaries get stuck together so that you can't get pregnant. But also in other entities as well, if you get a lot of adhesions, that can cause severe tummy pain and the bowel problems, and of course the quality of life would not be that good with having adhesions and related complications. Adhesiolysis, you make another surgery, then again you open up and you remove the adhesions and come back. The cut itself can trigger new adhesion formations. But in laparoscopy, because the trauma is less, and we can specifically identify these adhesions at the correct point, and once after the removal, the re-adhesion formation is known very less compared to the open surgeries. And the ovarian cyst, and this is we come across ovarian cyst what very often, especially in young girls who come with tummy pain in the middle of the night, and you do the scan, then you find out a cyst. Most of the cysts don't have to do anything; they resolve on their own. But some cysts they can cause pain, especially if they're twisted. We call it torsion. So maybe sometimes these cysts contain blood or endometriotic materials, then you need removal. And the cysts are effectively could be removed with completely from the laparoscope. And we have different types of cyst. Some cysts containing different tissues, the oily tissue, the muscular tissue, and the some other tissues like we call it dermoid cyst. These cysts usually, when we remove a cyst, we are expected not to spill the materials out of the cyst by using endo bag like this, a bag like instrument that we use during the surgery. We can collect everything into that bag and can come out with without spilling the materials, some toxic, corrosive or adhesion formation materials outside the out into the pelvis. And the hysterectomy, the removal of womb, we have to recommend certain times. Sometimes if you have a big fibroids and the bleeding, and then again some adenomyosis, or maybe with some early cancer stages also, with womb removal is recommended. The conventional method is going with a big cut, like in the picture, and then remove it. But now we can remove almost all the wombs with laparoscope without a cut. And earlier there was kind of a selection we had to make. We always used to select the patients who hadn't had more morbid in their past history. Like for example, if they have few surgeries, then of course surgeons thought, okay, the open method is more easier than laparoscopy, and also the ovary, the womb is more than 15 weeks. Then again, you thought of doing own open. But now with new techniques and some vascular ligation and the mosylation and the piecemeal removal, even a bigger uterus with adhesions could be removed with laparoscopy, which very easy for the patient afterward, and then with less complications. And especially the patient who had 2-3 cesarean sections, nowadays we remove them with the new methods, and without going for a open surgery. Ectopic pregnancy is another very commonly seen situation in patients with in reproductive age, and only this is this from the beginning it was done with laparoscope, but now we don't remove the tubes. But if you had gone through ectopic pregnancy earlier, if you were to do laparoscopy, then the treatment was removing that tube with the baby. Now we always try to conserve the tube by removal only the pregnancy tissues, and then suture the tube with suturing techniques. So then tube could be preserved, and the fertility could be preserved more than by comparing to removing tube. And newest methods are the surgery for the urinary incontinence and the prolapse surgery. And the urinary incontinence, you can't control the bladder. Every time you sneeze or you run or do the exercises, a little bit of urine could pass without your control. This happens when your bladder neck goes beyond its correct boundary. So that's a common complication in patients who close to the menopausal age. So it's really a distressing situation where you can't get on with your social day-to-day. Now we have the Colombo suspension surgeries, which gives a very good results for this kind of patients, where we take the bladder back to the normal position without making a cut. And then the results are very impressive. So it's a new surgery, and patients are also the long-term follow-up is better than going compared to the open surgeries. The other one is the prolapse, the uterine prolapse, which you commonly know. That the womb has come down situation. In the conventional surgeries, the womb is removed, and also the part of vagina is also had to be removed to make the correction. But in laparoscopy, we pull the things back up to the correct place, and then fix them to certain points in the tummy, is also effective. The advantage here is the vaginal shortening would not be there if in a patient of a young age, in a sexually active patient. If a prolapse is there, the laparoscopy method is more applicable and beneficial, because the sexual function will not be affected compared to the vaginal method. And you have a number of advantages in laparoscopy, and then we just, as we described, less trauma and no cuts, no large scars. The bleeding is of course less, and if you have hemoglobin low level, the laparoscopy will help to prevent bleeding, excessive bleeding during the surgery. Pain is less because most of the patients, they go home on the same day or the next day. Recovery is fast, and you can go back to your work soon and get involved with your sexual function, and also your work could be started early. And the cost was significantly high a couple of years ago. But now when you're comparing the new techniques and the time factor, the limited time factor, shortening of the time factor, there will not be a much difference between the open surgery and the laparoscopy in cost price, and also obviously and less long-term complications, and good for surgeon as well. And in laparoscopy, we get good accessibility and good visualization, and the more comfortable position that we could operate on, rather than just keeping or just bending over to open tummy. And yeah, so that there are limitations as well in the laparoscopy. In cancer surgeries, and there are some controversy whether to remove the cancer with laparoscope or not, especially if it's not spreading. And then sometimes the time factor, some surgeries take more time compared to the open surgery, especially in taking the specimen out. So all in all, the laparoscopic surgery has more benefits and more advantages. The message that you have to take here, and in case if you are going for your for any gynecologist or whatever for a situation, and get to know about surgical options, and then you may ask your doctor whether the surgery could be done with laparoscope. Yeah, it has less traumatic side effects. So this is what we have to discuss about. I think thank you for all the viewers, and hope you got something about laparoscopy.
Thank you, Professor Nishendra Karunaratne, for that excellent presentation, giving the ladies in our audience assurance that most of the common gynecological conditions can be treated with laparoscopy method. I would cordially invite Dr. Thushan Beneragama, visiting consultant plastic and reconstructive surgeon, to speak to us about the effect of cosmetic surgery on self-esteem. Over to you, sir.
So I have nothing to disclose, and the photographs I'll be showing in this presentation, not my patients, and then only for educational purposes. And in aesthetic surgery, how important for women, and not only for women, it's important for men also. But on this day, so I'll be mainly talking how important for women, and that it can make people they look better and also help people feel better. I think that is the most important thing. So how confident they become after surgery. But in my presentation, I'll be talking word rather than cosmetic surgery. That is commonly we use the word cosmetic surgery, but so what we can do, what is available here, and how important for women, and how to improve their look and their just self-confidence. So aesthetic surgery improves. You have to maintain your identity. You look like an alien. And aesthetic surgery improves physical, and psychological, and sexual well-being, and it can decrease anxiety, and it improves social interactions, attractiveness, and overall, it will improve the quality of life. This has been shown in multiple studies done in various countries. However, self-image is influenced by public opinion, norms, and aesthetic trends in the society and specific era and time. For an example, it's certain we will be directly influenced from the West and in certain Asian countries where the cosmetic surgery is very, very popular, and usually most of the women, they have the access to aesthetic procedures. So who benefits these aesthetic procedures? Naturally aging women, and after pregnancy, in women, so they can change their overall body shape, the tummy, the breast, and etc. And patients after weight loss, they will have sagging skin in the tummy, the thighs, arms, and various parts of the body. So they need some improvement to improve their overall appearance and to improve self-confidence. And you can see in this slide, so what happens in aging process? That is inevitable the process, and they will lose the volume and some structural support. And I don't think we like to go see this aging changes in our face. So therefore, there are certain things can be done to improve that. You can see how the aging, not only the face, the neck also, what happens, you see a lot of wrinkles and some excess skin can sag. So it can be improved. So what are the aesthetic procedures available? So it's not only aesthetic surgical procedures, there are non-surgical treatment also available to improve and enhance women. There are non-surgical treatment and surgical treatment, and there are the chemical peels, laser, and we use a lot of machines to improve the skin, the quality. And I'm sure like most of them, they talk about the Botox, and that is botulinum toxin and fillers and PRP. So there are minimally invasive or non-surgical procedures available to improve and enhance the overall appearance. And there are surgical options also available. And what we do is we combine both surgical and non-surgical procedures for best results. And there are aesthetic surgical procedures too, like there are breast surgeries, and there are surgeries we do for the tummy to improve the tummy, abdomen, and the nose, and thigh, face, neck, arms, ears, and we use certain implants also to improve and enhance the appearance of the individual, mainly women. And you can see in this photograph how combined surgical and non-surgical has changed the appearance of an individual, a female. But we have not changed her identity. And so you can see, because we all to be happy to, and we want to be younger. And this is what can be done with surgical and non-surgical procedures. And again, another example, you can see this face, it look tired, and you can see a lot of hanging skin and excess skin in the neck. So this is after surgical procedures, multiple surgical procedures to improve and enhance the facial appearance. So then they become much more confident, and I'm sure they will be very happy. However, the patient satisfaction in aesthetic surgery is the most important. If they are happy, they can become, they'll be overall, their self-image will be improved. But if they're not satisfied with the surgical or non-surgical procedure, so they won't be very happy. So then their self-confidence will not improve. The patient selection is the most important thing in these procedures. And patients should have realistic expectations. There are certain procedures we can improve. It's not a dramatic improvement. You see a subtle improvement. Like for an example, a facelift, Botox injection. You will see subtle changes. But certain procedures like abdominoplasty, that is a tummy tuck, nose rhinoplasty, that is a nose surgery, the patients will see a dramatic or a significant improvement. So they should realize what can be done and what cannot be done. And there are patients, there are people with body dysmorphic disorders. And so they are always worried about certain part of the body, maybe the nose, maybe the eyes, maybe the arms, but whatever you do, you cannot satisfy them. So then in those people, we cannot improve their self-confidence. Whatever we do, they are not happy. So they cannot improve their self-confidence. And there are obese patients. They are overweight and maybe obese, and we cannot change their overall appearance by doing surgery, because they have to go for a diet plan and exercises. So they are not ideal for these aesthetic procedures. But it can be done after weight loss. And some people think that cosmetic surgeries are weight reduction operations. Can I lose weight after this surgery? Answer is no. They are not weight reduction procedures. We do surgeries to improve and enhance the body. And with these, most of them, they are body contouring procedures. So therefore, they are not the ideal patients for these procedures. It is very important to educate people. And they ask most of the time, am I in the correct age group? There is no such age group. If they have a problem, it can be fixed. So then they fall into correct. So then, am I too late? Some people, they ask, am I too late? No, it is not. And so we always discuss the benefits and the possible complications with them. So they are well-informed patient. Is a very happy patient. And we always consider patient safety because these are not essential procedures. So we always talk about the safety and in the operating room, in the ward. So therefore, a lot of procedures in even the hospitals undertake, like into continuous medical education, registrations, accreditation, like that. So we have to consider their safety at different levels. So in summary, to improve women's appearance and overall appearance. So you can transform, you can see in this photograph, we can start transform this into a nice looking butterfly, but in very similarly in women also, in a properly selected patients, we can improve and enhance their beauty with surgical and non-surgical procedures. Thank you. I'm happy to answer if there are any questions.
Yes, there are few in the chat box. One says, can multiple procedures be performed at one sitting? How do you select?
It is possible, provided the patient is fit enough to undergo anesthesia. And so that is why, there are patients after pregnancy, maybe after weight reduction, massive weight reduction. So they have problems in the tummy, the breast, and the other areas, and maybe the face. But in those patients, we select them very carefully and we decide which surgeries can be done in a single sitting. But if there are multiple operations, so we like to divide into or maybe stagger and then do them. So we always consider their weight and the medical issues and things like that. So after consulting the anesthetist and the patient, so we decide whether it's safe, because I think that is the most important, the patient's safety. Whether it's safe to do these procedures together or maybe in different settings.
There's another question. If someone is having diabetes, can they also undergo aesthetic surgery safely?
Yeah, it is possible. It's not a contraindication for surgery, provided that that person's blood sugar is under control. If the blood sugar is under control, it can be done safely. But in a diabetic patient, you don't advise to do multiple procedures in one go, and in those patients, we prefer to do it in stages.
So there is one last question, which says, is there a particular age limit where you perform cosmetic surgeries?
Not really, because sometimes, some people, they lose weight at the age of early 20s, and maybe there are patients there are multiple pregnancies, but when the children get bigger, and so then they want to they want to look better. So sometimes they are over 50. So it all depends on the individual and how they feel and what they want. And so I think there's no age limit as such. Like classic example is there was a patient like, she was over 65, and Montessori teacher. So it all, and she wanted to improve her appearance. So it's all depends on the individual.
Thank you, sir, for that excellent presentation. We would now move on to the next.
Thank you.
Yes. I would like to introduce Dr. Kanchana Wijesinghe, visiting consultant general surgeon with special interest in breast surgery at Lanka Hospital, to make the audience aware on the topic of breast cancer, which is the most commonest cancer among women. Over to you, Dr. Kanchana.
Thank you, Chamindi. So yes, as you said, today is also another very good day for us to discuss about breast cancer like any other day. But being the International Women's Day, and today is a day where we are talking about women's empowerment, health, well-being, aesthetic surgery, I think it's another good time for us to discuss about breast cancer. So why do we need to talk about breast cancer among all the cancers that occur in females? So I think this slide speaks itself. Breast cancer is the commonest cancer among females in Sri Lanka today. So it's the #1 cancer that occurs among the Sri Lankan women. And approximately, now this says 3,000 new cases are diagnosed each year. But the recent reports say that it is now getting closer to 4,000 new cases being diagnosed each year. That means this is on the rise. And unfortunately, the next biggest problem is a majority of our patients present at a late stage. That is when they are having advanced breast cancer. When we would have liked to see them at an early stage, we see locally advanced, many patients coming with advanced breast cancer. And so because we see a lot of patients with locally advanced breast cancer, one of the leading causes of cancer-related deaths in Sri Lanka is breast cancer. So breast cancer being the commonest cancer among females in Sri Lanka, I think it is very important for us to discuss about it. I'm sorry, this picture overlaps the other sentence there. What it says is 1 in 8 women are at risk of developing breast cancer globally. So if you take 8 females, 1 woman is always at risk during her lifetime to develop breast cancer. So that's why we all need to discuss about breast cancer. So these are all some of the pictures of our own patients who are presented to our clinic with different forms of breast-related symptoms, but they all ended up with breast cancer. I'll just briefly highlight. So it may be a change in the shape of the breast, like you see in the middle picture here, top middle, or it might be a discharge in the nipple. Unfortunately, we have covered it, right? And then we have large lumps presenting like this in the bottom, and even it might be an indentation of the skin being pulled inside. So breast cancer can present in various forms. Now this slide is very important for all of us to know. if you just concentrate on the right hand side picture, this shows the stages of breast cancer. So we have 5 stages, 0 to 4. So what I want you to concentrate is, if you look at the 0 and 1, and you look at the survival rate of breast cancer, it is almost 100% and 98%. So wouldn't it be wonderful if we can identify all our patients when they are in stage 0 or 1, and then we can guarantee almost 100% cure rate. Now, if you look at this picture, you can see, so you get a small breast cancer, it progresses to stage 1, which is a little lump. Then what happens, it continues to grow and starts spreading out. So it has spread to the axilla here, the armpit. Now it's stage 2 and the survival drops to 88%. And likewise, it continues to grow in the body and the survival drastically drops. Now in Sri Lanka, the commonest presentation is either stage 2 or stage 3. In the majority of the developed countries, it is in stage 0 and 1, and they almost guarantee 100% cure rate for all of their patients. Messages is, shall we try to educate our females to come at least in stage 1. When they feel it goes bigger, go and get an opinion, go to your family physician, get a checkup done, right? So that's the key message I want to give you in this slide. Right. So now going back to the previous slide, I told you that the breast cancer progresses from stage 0 to 4, and this is the commonest cancer, and our patients usually present in stage 2. So what can we do as Sri Lankan women to beat breast cancer? The answer is early detection. This is the common answer all over the world. Early detection saves life. So how do we detect early? Now, if you look at this picture, this is just maybe a small fair. People have gathered. Some women in this crowd are having breast cancer without their knowledge. So how can we find these females and say, look, you have breast cancer, and treat them? 3 key things for the answer. First one is self-breast examination. Know what's normal for you. Second one is clinical breast examination, that is, get an examination done by your doctor. And the third one is screening mammogram. So there are 3 key things we can do for early detection, and I will touch briefly on all 3. Right. So self-breast examination is something that we can all do. We don't need a doctor. We don't need specialized investigations or equipments. This is something that all of us as females can practice regardless of our age, right? So what this means is, once a month, do a small examination of your breast to understand what is normal for you. Now, if we have access to internet, and we have Facebook, we are always on the phone. Why not take today to search on YouTube how to do a proper self-breast examination? A small task for you all, right? It takes 2-3 minutes. See how to do it. So 3 key things I want to tell you is, to do a breast examination, usually we recommend it to do it at least 1 week after periods, because we all know during periods and just before periods, the breasts are a little tender and nodular. So that's not the best time to do a breast examination. So do a breast examination 1 week after your periods. It takes 2 minutes out of your busy schedule. Feel your breast and understand what is normal for you. So when you know your normal breasts, when something is cropping up in your breast, you will immediately understand it. You will feel, so there is something different today. And then keep a tab on it. Keep notice of it. And if you feel it is persistent, go to your family physician or your nearest doctor or the government clinics, go and get a checkup. That's the whole idea of self-breast examination, so that you won't feel it when the lump is so big and obvious. And if you recall that picture, you remember, the bigger the lump, the stage is more advanced, right? So, but I want to say, majority of the lumps may not be breast cancer. But still, we don't know until we have properly been investigated. So Make it a point today to start doing self-breast examination and pass this message among your colleagues and friends and encourage them to do this. The second option is to get a clinical breast examination done. Now, this is properly practiced in some of the other countries, but this is very practically challenging. So imagine all the females in our country going for an appointment for a doctor or a nurse to get a clinical breast examination done. It is not feasible. We are already inundated with actually deceased females who have problems, diseases, maybe in the breast or any other way, any other place. So what happens is this becomes practically challenging, and even the females, who have no problem will not get an incentive to make an appointment and go and show themselves, right? But if you feel like this is also good, at least to get once in 6 months, if you're above 40 years, to get a clinical breast examination done. Now, the third one is a screening mammogram. This is the gold standard method for detection of breast cancer. If you recall that picture, just go back. Now you see, I told you there is stage 0 and stage 1. Now only a screening mammogram can detect stage 0 patients, because this is not clinically palpable or you cannot feel anything. So only a screening mammogram will be able to identify stage 0 patients, and that is why in all the developed countries they have proper screening mammogram national level programs. So different countries have different guidelines, but more or less if you are above 45 years of age, they will recommend a screening mammogram to be done annually or at least once in 2 years. Now unfortunately we do not have a national level program as such in Sri Lanka. But I don't think that needs to be an excuse for us to say, oh, we don't have screening mammograms, so we are having late presentations. We still have our self-breast examination and clinical examination available. And also today day and age, we spend so much money on fast food and whatnot, all the unnecessary things. I always say this to my colleagues and friends. It is also a good investment if you can get a screening mammogram done. You have not wasted your money. So the advantage of this is, as I said, was we can identify breast cancer at a very, very early stage, even before it has turned into cancer, and we can give 100% cure rate, and all the developed countries are providing this free of charge. And this is something we can, of course, talk about in Sri Lanka. We'll try to implement this in Sri Lanka in the future. In the meantime, know about this. It's always good to know. Actually, the dose of X-ray that you are exposed to is even less than for a chest X-ray. So it's a very small amount of X-ray that you'll be exposed to. It's like an X-ray, and this will identify very small cancers that cannot be felt. And of course, as I said before, the complete cure rates are much higher. Right. So let's say you have done your self-breast examination, or you have incidentally found a change in your breast, or you know a colleague who is complaining, look, I have an abnormal nipple discharge, or I'm feeling something funny in my breast. What should you do? I think the first thing you should do is you should be seen by a qualified medical practitioner, be it your closest general practitioner or the closest clinic available. Please go and get a checkup done, because you need to be sorted out immediately. And of course, after you have been seen by a doctor, sometimes the doctor might request for some more investigations or some more tests. They may request for a mammogram or a scan, or to be, a biopsy, which is, you take a small piece of the lump for further studies. If the doctor recommends these tests, please abide by it and do all these investigations, because these are recommended for your benefit. So get a checkup done and follow your doctor's advice. So again, I just want to reiterate, I want to show this slide. Don't wait until the last moment and come and seek for help when it becomes difficult for us to treat you and cure you. Early detection is the way. So try to practice self-breast examination and present early. Thank you very much, and I hope you all have a
Thank you, Dr. Kanchana, for raising awareness about breast cancer to our audience and giving the message that early detection saves lives. We will now take a glimpse of Lanka Hospitals Women's Wellness Center in a video.
Lanka Hospitals Ultra Chic Women's Wellness Center is an internationally benchmarked diagnostic and treatment center for women, offering a wide range of holistic screening packages tailored to meet the needs of women in various stages of life. This one-stop center, encompassing many important medical services and facilities for girls and women from puberty through menopause, is modeled to mimic women's wellness centers in the developed world and to be on par with international healthcare standards. Lanka Hospital's Women's Wellness Center is unique in its ability to ensure privacy and in providing swift, efficient and cost-effective treatment under one roof for female patients suffering from various health conditions. A comprehensive range of women's wellness packages is now available at Lanka Hospitals, including routine well-woman care, pap smear, breast screening, treatment for prepubertal and issues regarding menarche, menstrual disorders, benign and malignant breast issues, prenatal, delivery and postnatal care, treatment for gynecological malignancies, family planning, breastfeeding issues, women's psychological care, premenopausal and postmenopausal care, treatment for female urinary incontinence, sexual function disorder, gynecological cosmetic surgery, premarital counseling, health education, parent crafting, and for the first time in Sri Lanka, a breast cancer family history clinic. The Women's Wellness Center of Lanka Hospitals also houses the latest state-of-the-art digital mammogram machinery, ensuring minimal discomfort and lowest radiation to patients. The latest of its kind, Fujifilm Amulet Inability, has the highest sensitivity to detect breast cancer at a very early stage, while having the capability of performing breast biopsies and localized procedures. With state-of-the-art detection, therapy and well-known specialists on call, those not only afflicted by breast cancer, but females affected by any medical condition can be treated in comfort and with efficiency at this facility. The multi-award-winning internationally accredited Lanka Hospitals plc is poised to deliver maximum patient safety and superior care in compliance with the Joint Commission International Accreditation it is honored with.
I would like to mention that marking the International Women's Day, Lanka Hospitals Women's Wellness Center is offering certain discounts on breast package, gynecological package, and platinum package. And for further details, we will be uploading our flyer. And our cosmetic center, the Radiant Center, offers 10% discounts for abdominoplasty, commonly known as tummy tuck, a liposuction of the abdomen, and rhinoplasty. We have now come to the end of our session today. I would like to thank the management of Lanka Hospitals for giving the opportunity to organize this event. My heartfelt gratitude goes to eminent panel speakers, Professor Nishendra Karunaratne, Dr. Kanchana Wijesinghe, and Dr. Thushan Beneragama for dedicating their valuable time to be with us today and sharing their wealth of knowledge in raising awareness among our audience. Last but not the least, to all our participants who joined with us today to make this event a success. Thank you and have a pleasant day.